Good afternoon. This is Kemal Erkan. I'm the chairman of American Surgery Center, as well as United Medical ACO. This is our Bariatric Friday event, and I have Dr. Isaias Irgau with me from CHRIAS and from American Surgery Center. Dr. Irgau, how are you doing?
I'm doing very well. Welcome everybody to Bariatric Friday. Thanks for having me, Kemal.
Thank you. And Dr. Irgau, we are gonna discuss a support group today from the bariatric surgery journey. Now, knowing that these are issues that many of our patients are going through, we do have a support group on Tuesday nights. It's an online event, and we want to make sure that we can discuss a couple of the ideas. And I want to share some of my personal fitness-related issues, and then as you are one of my closest friends, so you also know these from firsthand, and I want to actually give you some data today, and then maybe we can have some discussion around that as well. I'm going to go ahead and introduce our other surgeons in the program. Dr. Irgau, I'm not going to introduce you anymore because apparently you are way too famous, so everyone knows you, but Dr. Irgau is our president of CHRIAS, and also he is the medical director and the program chair for American Surgery Center in Wilmington, Delaware. So we have Dr. Gail Wynn, Dr. Michael Peters, Dr. Rahul Singh, and Dr. George Ibrahim on the bariatric surgery side, as they are bariatric surgeons, but they're also general surgeons, obviously. So everyone knows them already. And Dr. Sachin Vaid is our colorectal surgeon, and he is also very experienced in his area, and we are lucky to have someone like him in our team. And with some of our patients, we may need to work with them. They may need some work with the GI-related stuff, but also he serves for our accountable care organization and our patients, and we appreciate what he does for us. From our registered dietitian standpoint, we have 3 people on in our team, and these wonderful ladies, Fran, Amy, Beth. So all day long, 8 hours, all they do is support and educate our patients on nutrition, and we thank them for what they have, what they do for us. From our surgical expertise standpoint, this is not just any other program. One of the reasons that we are able to do what we do today is because we are able to do it. So we also know that there's a need. So Dr. Irgau, you are the visionary for the bariatric program and what this needed to look like. And when you and I, we started working on the surgery center, we put almost 2 years into that before we went live. And, but for the entire practice, if you can kind of give us a background for how much experience CHRIAS has and why a patient would be happy to with CHRIAS and the CHRIAS surgeons.
Absolutely. Thank you, Kemal. So there are really few areas of medicine where expertise matters so much, Kemal, than bariatric surgery. It is very, very important for the surgeons to be experienced, not only in the actual performance of the surgery, which requires obviously a high level of training and skill, particularly when it's done in a minimally invasive fashion, which is how we do it, but also because bariatric surgery requires really a deep understanding of the metabolic issues related to obesity and their resolution. So ours is probably the most experienced practice when it comes to that, simply because we have been doing this for the longest, right? We started our bariatric program way back in the very beginning of the 2000s. So it's almost 20 years since we started the program. And clearly, there was no bariatric program to speak of at that time, at least in its modern form in our area. Many of the hospitals that we have in our area, Kemal, did not have any bariatric surgeons, let alone bariatric programs. So we were instrumental in setting them up, and many of those hospitals earned designations of Center of Excellence because of the setup that we were able to provide for them through the experience we had in bariatric surgery. We have been performing bariatric surgery for almost 20 years. We have many thousands of surgeries that we have performed, and patients we have helped successfully. So experience matters a lot when it comes to bariatric surgery. As you correctly said, our practice is by far the most experienced when it comes to our area, not necessarily only in Delaware, but also the surrounding counties of the surrounding states, whether it's Pennsylvania, New Jersey, and Maryland as well.
So thank you for that, Dr. Irgau. So we are going to discuss the support group aspect, but for those who may not have seen the other topics, we try to actually divide these into smaller portions, just like our food. So then there are smaller videos, shorter videos, so then everyone can watch what's happening with the type of bariatric surgery, which one is better for you, life after bariatric surgery, why patients drop from the bariatric program before they get their surgery, maintaining weight after surgery, patient perspective of bariatric surgery journey, who's a candidate, and last week we did the multivitamin. So after the last week's session, I had my weekly meeting with Dr. Irgau, and I showed him a couple of the things that I do in my life with the gardening and the fitness stuff. And then he said, well, we should have talk about the garden because when we say multivitamin, the main thing is it's the freshness of the food. And then I'm like, yeah, we probably need to discuss some of these more. And then also, I'm actually emailing, sending a letter to many of our patients. We want to bring them on to this show, this session. So I'm hoping that we can actually hear directly from them. Now, they may be a little bit shy as the bariatric, unfortunately, is being discriminated for years. People are okay to talk about their diabetes issues, but when it comes to obesity, there's the public pressure on people. We do it knowingly or unknowingly, we do it. And support group is also extremely important from that point. Now, Dr. Irgau, you know pretty much everything on my side, but what you may not know is, so I'm gonna see if I can, so here, okay, and just getting my other stuff ready. Before we actually, I skipped one other thing. Before we go to my personal support group session, I'm going to actually discuss this new study came out. Now, you mentioned that you actually talked about this last week. I thought it was the prior, like a couple of years ago, research, so I didn't actually pick that up. But this is what I'm talking about. This study is done by a group of providers, researchers, and this was published on the Lancet. And Dr. Irgau, you do really good on explaining complex issues and diagrams in the way that we can understand. If you can just tell us about what's happening here.
Absolutely. So this is yet another study that is extremely important because it is showing now the actual meaning of the work that we do, Kemal, right? At the end of the day, really, yes, we are making people thinner and happier, but are we having an impact on what matters most? And that is the extent of their life, right? And this study has shown, again, like many other studies before, that when you compare people who struggle with obesity and you divide them between the ones who decided to have bariatric surgery and get rid of obesity and related illnesses, and those who have not had bariatric surgery, when you follow them for many years to see what their life expectancy is, they have shown that people who have had bariatric surgery live longer. Those who have obesity and diabetes live on average 7 years longer than the people who didn't have surgery. Those who don't have diabetes but just have obesity, when they have bariatric surgery, on average, they live 5 years longer. This is hugely impactful, Kemal, because we're saying, look, not only we are making people have a much better quality of life, but we are making them live longer as well. And there's nothing more precious than that. And that is really the core of the importance of bariatric surgery. It is interesting, Kemal, because obviously bariatric surgery is coming up as an extremely important form of treatment at a time in which in our society, obesity is wreaking havoc. Obesity is pervasive, right? The rates of obesity have been going up since the 1980s at an accelerated pace in the United States. So much so that there is almost no state without a significant percentage of obesity in the United States. In fact, there is a very interesting set of slides from the CDC that shows you the obesity rates in the 1980s compared to the obesity rates now in the United States, and the amount of obesity is incredible. Well, what this study is telling us, Kemal, is that if you have obesity, you live less years than if you didn't have obesity. That's exactly what it's telling us, right? So interestingly, although with the improvement in medical care over the last 100 years, generation after generation, we have seen an increase in life expectancy. In other words, the generation that comes after lives longer than the generation before. This may be the first time in which a future generation actually lives less longer than the previous generation. Why? Because of obesity. In other words, obesity is killing us. And when obesity gets to very high levels and you stay like that, you live less years. And this study is demonstrating that you actually live longer if you have bariatric surgery and you are thinner, right? So we are demonstrating now conclusively that denying this treatment really is unacceptable. So if there are insurance companies, if there are health plans that deliberately exclude bariatric benefits from patients, it is going to be bordering towards almost negligent, because this treatment is life-saving. You cannot really say to patients, I'm providing you health insurance, but you cannot have this life-saving treatment, right? So denying bariatric coverage should be completely unacceptable from that point of view. And this study should be presented to all our lawmakers as well, so that really they can make it very clear for all health plans that they cannot discriminate patients when it comes to offering bariatric surgery.
Thank you, Dr. Irgau. So I'm going to go back to my personal support group session now. Yep. So now, maybe just so that any patients of ours, if you are watching this, what you have to really, maybe it's our fault that the way that we are actually maybe explaining, not our practice fault, but as the programs. Anything that we are providing, anything that we want patients with obesity to follow, it's not unique for those patients. So that's the part that I don't know if you are able to highlight that enough. I played tennis for the last 25 years of my life. I'm pretty active with the walking and other stuff. And I used to run, but now at age 47, things are slowing down. Different things are changing. Pandemic happened. My dog got sick in November, where he wasn't able to walk anymore as much as like we used to. We used to take a long walk, and that was my exercise. So what I didn't realize is that the impact, and Dr. Irgau, you maybe politely you were saying this, but maybe we were just focusing on the diet a little bit more, but which obviously I still do that. But here's what I want to show you and how easy to actually, even for people without the morbid obesity, this is what happens. So this is January, 2,400 steps for the month of January that I had. This is based on my phone, and my phone is always with me. Although I got this new bionic ring, but the phone, as like if it's not accurate, it's not accurate for every month, right? So it's not just 1 month, it's not accurate for the phone. So the reason this happened here, because end of November, we stopped walking. So 2,400 steps. So then, and then February is even less. Maybe it was colder. And then I had all the excuses. Oh, I want to spend more time with the dog. He can walk. And then I maybe abused the emotional part of that. I took advantage of that. So, and here's when I went to Turkey and realized that, and then two of my friends visited me, and then I'm like, oh my God, like I'm the only one who gained a lot of weight. And then yet what I realized is that as you can see here, like the part of the issue is, this is March and then it's 56, but the beginning of March was nothing happening. So, and I was not moving. And now, from this, what I want you to see is when I started actually moving more, immediately I saw the impact, but then I had to push myself to do more. And then in April, 5,800 steps. And so far in May, I'm at 7,500 steps.
Excellent, excellent.
So yeah. Now, I didn't buy any expensive gym equipment. In fact, I didn't purchase anything. So this process that you saw, it started from 2,000 and then to 7,500. That happened because I started pushing myself to walk. Now it's, in here, you can actually see like what happened. This all started in November here. So I don't know if I'm gonna actually just point it here. So it all started the Thanksgiving Day, body crashed. And then I stopped doing everything here. And then that's when my body started changing. Now, I still didn't have morbid obesity after all this, but it was a lot more than what my body was used to. Now, if I don't do this, things are not good. So I think maybe what I'm trying to say is, and then because we have the support group, and Dr. If I'm out of line, you can always stop me, as you know. Maybe we are kind of providing or presenting some of these things as like if the bariatric patients are a victim of this illness, but it's not. Like we want them to just do what you and I do, right? So
absolutely. I mean, I think this is actually extremely important, Kemal, because what we are pointing here is that you do not have to be a marathon runner or a gym kind of fanatic for you to embrace exercise. In fact, from our point of view, what you have just expressed is exactly what we want to see. We want people to move, right? Move as opposed to rest. And there is nothing more complete than walking when it comes to moving, right? So we are fortunate we live in a day, in an era where we can actually, we don't have to count our steps ourselves to keep track of them, right? We have this gadget that is in our pocket with us, right? Pervasive, takes pictures, does many things for us, but it can also count our steps. It can tell us how many steps we've walked. So this is a discussion I really take a lot of time to have with my patients, Kemal, because I think it's important for people to understand there's just moving, just walking by itself is extremely important when it comes to improving our health from a cardiovascular point of view, but also influence our metabolism to complement what we do when we decrease how much we eat, right? And this, you are absolutely right. It doesn't matter where you are from a bariatric surgery point of view. You could be not a candidate for bariatric surgery because your weight is not that high. You could be somebody who's a bariatric surgery candidate, but starting the program. You could be somebody who's had surgery and you're many years out. Walking should be a universal activity for all of us. Absolutely. Now, it is obviously, if somebody who lived 500 years ago come out, listen to our conversation, they would think, you know, what are they talking about? Of course you have to walk. You have to walk to go everywhere, right? But we have lost that because we have automated our society. Right now, Okay, for everything there is remote control. For everything there is a machine that does it for us. More importantly, for movement, to travel, to go to the store. Nobody thinks about walking to the store anymore, right? Unless you live in a city like New York, where obviously everything is at within the block next to you, right? Otherwise, you have to drive to go anywhere. In fact, in many places, including Delaware, Kemal, you cannot walk somewhere. You get killed if you try to walk to go to the store or other places because the infrastructure is not there. So we have to reinvent our life, right? To really make walking an important component of what we do every day, right? So if we work in a place where we're sitting all day long, we're not going to walk, right? So if our telephone, we look at our data and it tells us, okay, today you've done only 1,000 steps, that's just far too little. So what we have to do is when we come home, we have to purposely go around our neighborhood or go somewhere where there is a walking path and purposely walk. So we have to get to that 5,000, 6,000, 7,000, and eventually 10,000 steps a day. That is on average about 4.5 miles, which would get us really to an extremely great, healthy setup. So again, walking, and this is essentially what a support group is, by the way, Kemal. It's really exchanging these ideas. And you yourself were talking about, importance of support group, but you changed it into a support group by itself because you are sharing your own experience. And that's what support group is. It's not somebody really lecturing people. It's people coming in and saying, hey, this is what I'm doing. Or this is a challenge I'm finding. Did somebody find a solution for this? And people share their experiences that way. And that's why support groups are very important. We encourage them. They are an integral part of our program. And as you correctly said, we have them now on a virtual platform, which is easily accessible. It's moderated by one of our either surgeons or nutritionists, but the key is the discussion is between the participants, and that's the essence of it. And one day the discussion could be about increasing activity by walking. Another day it should be how do you improve your protein intake by expanding your menu without really getting into junk food and other things, right? And those ideas can be provided in a support group very easily. So support group is very, very important.
The key point for me was how easy what I needed to do, but just getting to that, just breaking that habit of, or the excuses, like, okay, no option, we have to do it. So now it really takes only 22 minutes in the morning for 1.8 miles. And then I do the same at night. Yep. And then throughout the day, I try to be more, like sometimes I deliberately forget stuff on the second floor. So then I would just go and have like an extra trip. Before we were trying to get everything that you can from the second floor so you don't have to go back. So I think some of the little mind games that we can play that can probably help. But my main point from the non-clinician standpoint, this is not for bariatric only. Anyone who's watching this can benefit from this. Absolutely. Everyone is going through. I talked to my mom this morning, and she's kind of stressed out, and I'm like, go and walk. Because it helps. It's not about the weight gain or weight loss. Go and walk because it's going to help you with the way that you feel. The other day I was talking to my dad. He's 80 years old. He's like, I'm going to start walking again because I feel I feel that my body actually is pushing me to do it. So because he's not happy when he doesn't move enough. So I think small stuff that can make a big impact. On one of our diabetes dietitian sessions, we are going to actually feature the little gardening that I'm doing. The only reason I'm doing that is so that it can actually help people. Well, actually, I'm lying now. That's not I was not thinking about that. But then when I was doing it, I just thought about this would be helpful if we share. And Amy actually said that it would be really good for, especially patients with diabetes. Then I was thinking even for our bariatric patients, that we can actually show how simple, how inexpensive in some cases, and and how easily accessible and how quickly it happens. So you saw the garden the other day. It's not a lot of stuff. I can do more, but I just didn't want to deal with too much. But if I was relying on that, I could do more. So it's really simple from that point. Now, Dr. Irgau, from the bariatric patient, our patient with morbid obesity, the other thing with the support group side is we do telemedicine these days a lot more, and we got more efficient with telemedicine. So I do want to just remind our patients that we have telemedicine available, so you don't need to leave your home for anything that can be done through telemedicine. I really urge everyone to activate their portal and make sure that you have a private environment, test your technical devices, remove distractions, and have the necessary information ready. But also, this is available right on your phone. It's so convenient, not only for the visit itself, but you can also use it for canceling your appointment, checking your time of your appointment. I can only tell you how stressful or how maybe wasteful when you guys call our offices. We don't have 100 people waiting for phone calls. So, but we can answer these non-emergency questions or requests through our patient portal, which is now part of our telemedicine. So we want to make sure everyone is adapting these. I know, Dr. Irgau, you do mostly telemedicine and you use the video visit. How's your experience so far with that?
Great, absolutely great, Kemal. I think, we are able to add convenience really to the visits because, as you correctly said, patients don't have to take half a day off to be able to have an encounter with us. So we can be a little bit more, at ease when we ask patients to come back and see us within a short interval after a visit to check on them. And they are more ready to accept that because, again, they don't have to take that much time off. So that's a very big advantage. The other advantage, obviously, to this is that when we need to talk to patients, when they have an emergency, when they have a question, of course, you can talk to them on the phone, but sometimes the actual picture tells us so much more of what's going on with them. And that really adds a lot of value to our encounter. I was telling you not too long ago about a patient of mine that needed help. And rather than answer to her by calling her back, I initiated a telehealth visit so I could see her. I could see immediately that she needed to go to the hospital to get hydration because she was struggling with hydration. And I would not have been able to detect that as readily if I hadn't seen her, right? Or if I had waited for her to come to the office, which would have been a huge challenge for her. So telemedicine is very, very important. But as you correctly said, Kemal, in our setting particularly, telemedicine works best when you are signed up to the patient portal. That's really the means for you to have that interaction. So our system is integrated with the telehealth visit with a video connection only when the portal is working, because that's how we can add a layer of privacy and security to the encounter, because it's important that this remains private, right? We are distant, but it remains to be private. The system allows us to do that. So patients have to sign up to the patient portal. The other thing I want to say is sometimes these things are very much dependent on the quality of connection, the internet and other things, right? So those can be frustrating sometimes, but it's okay. We work through them. I mean, we work through connection issues when we have other uses for, whether it's phoning a friend, having FaceTime and other things, right? So we can work through those snags. So it's very easy sometimes to get frustrated, but if we work on them, we can only improve on them. So, and I've seen huge improvements from the time when we first started this to now in how easily we can make this. So it definitely has added a huge value to our encounters, Kemal.
So, and also, like, I'm thinking that as we are able to do more of these visits, the need for the support group, like you have to have the support group versus you have conveniently convenient telemedicine available. Because in some cases, you may not want to discuss everything maybe with other people there. And also through our Center of Excellence program, we do require patients to follow us through every year, at least once. So that actually, from that point, is also important. Dr. Irgau, I'm going to try one little thing here, and if it doesn't work out, I will not take too much time. So, like every time when we do these things, we are able to do different stuff here. So I wanted to actually see if we can try this. So since we did so many of these events, so then it's okay to have take little risk here. So while we are both there, we discussed about the medical transportation for those patients with the Medicaid. And also we discussed the upcoming events, which they are kind of like our set events these days. So then we have all the like the Fridays now, we call them Bariatric Fridays, and we have second and fourth Tuesdays. If you need more technical knowledge or info from the process, those are good events to have. They're done by the CHRIAS surgeons. And then we have our Friday event for the United Medical ACO, and then Wednesday wellness webinars, which is happening second and fourth Wednesday at 7 p.m. The support group, as I mentioned, is the first Tuesday of every month. And that's pretty much what we have from our side. So Dr. Irgau, anything you would like to add before we close?
Absolutely. Kemal, thank you. I think we've said many things. I do want to add another important point about the walking issue, right? It is clear that some of our patients, because of the weight and also because of the impact the weight has had on their joints, have great difficulty sustaining long walks, right? We understand that. It is sometimes, some of them actually have to have some type of help for them to walk, either a cane or even a walker, just because the weight is so much and their joints really over years and years have been worn out and they have pain, they have difficulty. We understand that. So it doesn't mean that we require everybody to do those, half hour, 45 minutes walks, not at all. What we're saying is that there has to be some movement. So the difference between movement and no movement by itself is huge. It doesn't matter how much the movement is. Just that little difference of getting up is important. So what I tell patients in these situations, Kemal, is that even if you cannot walk more than 5 minutes, that 5 minutes by itself, if it's done frequently during the day, is priceless, okay? So you're sitting down, you've been sitting for a while, it's been an hour, just get up, walk a little bit, 2-3 minutes until it's unbearable, until it's difficult for you, right? Obviously, we don't want you to suffer. Then you go back to sleep. But just because you have interrupted that long periods of sedentary posture into active movement, you are actually transforming many things in your metabolism, in your activity, in your cardiovascular endurance. It is very, very important. So it is so understandable for people to just give up and say, you know what, I have so much pain. I cannot be like that person who's always up and walking. I cannot be like that person who's always exercising. I understand that. That frustration is there, but just doing those little bit of activity, getting up and walking, even for a few minutes at a time, frequently during the day, will make a world of difference in their outlook. So that is very important as well.
And all it needs is just a little bit that motivation, and then it will be, once you start, you'll see the benefits anyway, and then you don't want to go back anyway. So now, again, this program is specialized in bariatrics. So I cannot say the same thing for everything else, but bariatric is our business. And no one else is more experienced than our group. Our nurses, actually, the reason I'm mentioning this is because next week I'm going to have I do want to discuss our patient satisfaction, the reason that we are successful with our patient satisfaction scores. And because it's the Nurses Week and Nurses Month, I thought it would be more meaningful to bring our nurses in the surgery center. They are pretty frequently mentioned in our patient surveys. I am extremely proud of them. A couple of them, they've been there since the United Medical Business Office, and then they became nurses later on. We have a great leadership with Michelle Ciano, and Michelle is going to bring one of her pre-op, one of her OR, and one of her PACU nurses next week, and we are going to have the discussion with them and just ask them a couple questions about what they do differently for them to be so successful with the good patient outcome and then patient satisfaction. So that's what we are going to do next week. Dr. Irgau, thank you for joining me today. And
thank you. Thank you. That's a terrific thing. I look forward to it. Kemal.